Approximately every 3 minutes, one person in the United States is diagnosed with blood cancer, and approximately every 9 minutes, someone dies from it. We can change that. We can help cure blood cancer by signing up for the bone marrow registries. Some bone marrow registries in the United States or worldwide include the National Marrow Donor Program, which operates Be the Match Registry, the Gift of Life Donor Bone Marrow Foundation, and the Delete Blood Cancer DKMS. You are able to donate blood stem cells for bone marrow transplants in two different ways. The first type is peripheral blood stem cell donation, also known as PBSC, which is a non-surgical procedure called apheresis. The donation then takes place in an outpatient hospital facility or an experienced blood center. For 5 days leading up to the peripheral blood stem cell donation, the donor will receive injections of the drug filgrastim, which will increase the number of blood stem cells. On the day of the donation, the blood is removed through a needle in one arm and passed through a machine that will collect only stem cells. The remaining blood will be returned to the donor through a needle in the other arm. Each session can take up to 8 hours. The second type of donation is blood marrow donation. This is a surgical procedure that will use anesthesia. During the procedure, doctors will use needles to withdraw liquid marrow from both sides of the back of your pelvic bone. Bone marrow or stem cell transplants offer people the best chance of recovery. Chemotherapy and radiation can destroy the bone marrow. After their treatments, cancer patients can receive bone marrow transplants that will replenish the body with healthy cells. Let's start by going over why donating bone marrow is so important. What is bone marrow? Bone marrow is a soft, spongy material found in bones. It also makes over 20 million different cells a day. The most important part of bone marrow is the stem cells. These stem cells are important because they are able to mature into several different cells. These cells include white blood cells, red blood cells, and platelets. Now that I have covered why bone marrow is so important, I want to talk about why you should become a donor and how you can do so. Why should we donate? Only about 30% of people who need a bone marrow transplant can find a donor with a human leukocyte antigen, also known as HCl, match within their immediate family. Human leukocyte antigen typing is used to match patients and donors. HLA are proteins which act as markers that are found on almost all cells in the body. The immune system uses these markers to recognize which cells are foreign and which cells are native. The other 70% of patients, doctors have to try to find a match within multiple registries. Finding a match on the national registry is hard. Only 2% of the population in the United States is a part of the national registry, and at any given time there are 7,500 Americans looking for an unrelated donor. Statistics for the likelihood of finding a potential match is as follows. 25% for African Americans, 45% for Hispanics, 75% for Caucasians, 40% for Asians. Of all the patients, multiracial people face the worst possibilities in finding a donor. Once a patient is matched with a donor, the likelihood of having the donor who is able and willing to donate is low. Percentage of participation who follow through with the donations are as follows: 65% for Caucasians, 44% for Asians, 34% for African Americans, and 47% for Hispanics. Who can donate blood marrow? Healthy adults between the ages of 18 and 60 can donate blood marrow. if they are matched with a patient. They first have to pass a medical examination and be infection-free. Most people who take medication are still able to donate as long as they are still healthy and they have their medical condition under control. Pregnant women, non-prescription drug users, cancer patients, people with certain heart conditions, and people with hepatitis B or C cannot donate bone marrow. What is the donating process? The first process is to register to become a bone marrow donor. One way to locate a donor center is by visiting the National Marrow Donor Program's website. If you can't find a center to visit, you can register online and the National Marrow Donors Program will mail you a tissue typing kit. Some donor centers may charge a fee, though there are centers that are also free. The next step is to complete a medical questionnaire and sign a consent form. The consent form will make sure that you are going to go through with the donating process. Then either a small sample of blood or cotton swab of the cheek cells is taken. This is used to find out the donor's HLA type. When a match is made, the NMDP registry will contact the donor and a new sample of blood is taken. This is sent to the patient's transplant center and confirms the HLA match. Additional blood tests might be required. Once you are cleared to donate, the patient's doctor will determine which donation technique they will use based off the needs of the patient. A majority of the time, the PBSC process is used. Now that we have looked at how the donating process is completed, I will suggest why I think you should donate bone marrow. I believe that donating blood stem cells is an important method to helping cure blood cancer. Donating not only affects the patient, but the people around them. A mother whose daughter, Clara, was born with leukemia said, "I have no idea how to thank you or how to really begin the conversation with you. It's kind of impossible to truly express our gratitude. You made a choice that many people do not make. Your choice, self-sacrifice, and prayers saved our daughter's life. You can be the difference." Thank you for watching.